Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Glad that you could join us today. Our guest today is Elizabeth Buckle. She's manager of Interoperability Solutions, product management at Greenway Health, and she's joining us here on the program today to talk about interoperability and some of the questions that healthcare organizations should be asking before they choose a new EHR for the coming year. Welcome to the program, Elizabeth. Thank you for joining us today.
Hi, thank you for having me.
Well, first of all, interoperability. What is interoperability and what does it mean specifically to healthcare organizations?
Sure. So interoperability is the ability to easily and effectively share data that is important for each individual care episode for a patient. So this means that effective interoperability isn't just sending anything and everything under the sun, but really making sure that providers are able to send and receive exactly what is needed to make informed decisions about their patient's care and to be able to do so within their workflow.
So are we talking about a human that actually sifts through each individual request for information, or do you have a platform that can determine what is needed and what is not in each individual request?
Sure. So it definitely depends on the use case or situation, but really what we're trying to get at here is the ability to have certain configurations and settings to take that manual step out of the process and really say, in this particular scenario, this is the most important data that needs to be exchanged.
So when it comes to, I guess, managing that interoperability, do you go in and manually babysit these organizations until they're up to speed and all of their current systems are working seamlessly with whichever system you decide to implement? Is that how it works, or is there something else going on?
When you say manually babysit, there's certain phases that an integration will go through. And with any model, with any EHR, it likely works the same. When two different systems are looking to exchange data with each other, there's an integration period, and that would be probably more of the babysitting step where there's actual technical developers or project managers who are reviewing the transmission of data back and forth to make sure that it is, in fact, meeting the goals set forward by the different organizations that are exchanging their data back and forth. But really, the ultimate solution is then at that point, once those parties agree that the data exchange is meeting their needs, that everyone can step back and allow that to take place with as little manual intervention as possible.
So I would assume that going through that transition as quickly as possible would be beneficial. What types of questions up front should an organization be asking before they choose an EHR vendor for this coming year?
Absolutely. So you're right. It is important to make sure that those discussions around what the expectation is for the practice who might be searching for a new EHR, that they ask those questions up front. So EHR companies across the board are at different stages of interoperability maturity. So ensuring that you get a level of interoperability that works well for your practice really depends on proper discovery up front during the EHR search. So, for example, if a practice wants to exchange data, a clinic wants to exchange data with their local hospital, but in the search process, they don't discuss this up front with the EHR vendor, they may choose an EHR vendor that doesn't have that capability, or that has it, but that, it's a clunky workflow, or it doesn't really fit within their natural workflow within the application. So it is very important to discuss this up front. And that's not to say that the responsibility is solely on the practice. The EHR company has a responsibility here as well. So at Greenway, we do place a lot of emphasis on proper discovery in those conversations with potential partners just to discover exactly what they're going to want to achieve, both within the application and also as it relates to data exchange.
Is there ever an instance where an organization, their system isn't, I guess for lack of a better term, mature enough to take on, say, an upgrade of your level? Do you steer them in another direction, or do you always try to bring their systems up to speed with the latest in EHR technology, regardless of their level of technology?
That's a good question. So at Greenway, we have data exchange models with many different vendors, and those different vendors may connect to other EHR systems. They may connect to payer organizations, labs, radiology systems. Really, the scope is endless. And all of those different connections can use a different maturity level, I guess you could say, of data exchange. And so at Greenway, we're able to support a great deal of that. And then, there's new standards that are quickly coming on board. And so we're working through the best process to keep up with those standards, the new ones that come up, while still maintaining some of the older, more legacy standards as well, because we understand that in this environment that there's just a large variance, a large variation in what can be supported across different vendors. And so we need to also be able to handle that as well. Would
you say that Greenway Health is involved in defragmenting the space as far as EHR selection is concerned? And in defragmenting that space, do you focus more on larger healthcare facilities or the smaller facilities where a few doctors have gotten together and formed a practice?
I would say that it's really all of the above. We focus on, from a data exchange perspective, we focus on what's most important to meet our customers' needs. So we focus on big and small. One of the larger initiatives that we have spent a great deal of time focusing in on is the care quality pilot. So we have participated through our Commonwealth Services agreement that we have through the Commonwealth Health Alliance. We've participated in a care quality pilot that's going to open up the ability to exchange data with around 1,500 hospitals and 39,000 clinics, in addition to the already around 11,000 or so organizations that are on the Commonwealth network. So those organizations can be big and can also be small. So it's really a large, variation on the spectrum of who we can exchange data with. So our focus is really on just opening up the ability and then allowing our customers to select what makes the most sense for their organization.
Give us a website where we can go and learn more about Greenway Health and a bit more about this interoperability solutions that you offer.
Sure. So for more information, you can visit us at www.greenwayhealth.com. We do have an interoperability page with a lot more information on what we offer.
Elizabeth, thank you for joining us on the program today.
Sure. Thank you so much for having me.
Great. Elizabeth Buckle, Manager of Interoperability Solutions Product Management at Greenway Health. Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.